My tutorial presents bipolar disorders. Bipolar disorder is characterized by recurrent episodes of mania and depression in the same patient at different times. It was earlier known as manic depressive psychosis. So, in bipolar disorder, both mania and depression occurs. The mania is characterized by abnormally elevated mood that is associated with exaggerated behavior. In mania, a person becomes talkative and there is an increase in energy levels or agitated behavior, and he considers himself in a euphoric state, which is a state of exaggerated sense of self-confidence. Whereas depression is opposite of that of mania. That causes a persistent feeling of sadness and loss of interest. So in bipolar disorder, signs and symptoms varies between severe mania and severe depression, including less severe form, that is hypomania, or mild to moderate depression, which occurs in milder form. So again, in bipolar disorders, the symptoms varies between mania to severe depression. However, the symptoms may lie in between in case of milder form of bipolar disorder. The etiological factors include genetic factors, as studies have shown that they are more prevalent in first-degree relatives and in twins, and certain biological drivers, such as neurotransmitters. For example, increase in serotonin and noradrenaline level results in manic phase, whereas decrease in serotonin and noradrenaline results in depressive form of bipolar disorders. Similarly, neuroendocrine system such as hypothyroidism result in depression, whereas hyperthyroidism or thyrotoxicosis results in mood elevation. And there is also evidence of sleep dysfunction. And at last, psychosocial factors. As studies have shown, bipolar disorders are more prone to occur in single-parent child or in the child that are adopted. However, they are equally prevalent in both men and women, but the onset of bipolar disorders tend to occur later in women than that of men. Difference between bipolar 1 and bipolar 2. Bipolar 1 is the most severe form of bipolar disorder, in which the symptoms varies between mania and major depression. Bipolar 1 is characterized by at least one manic episode or mixed episode, that is both manic and severe depression episode. Whereas in bipolar 2, the patient never had a manic episode. Instead, he has a less severe form or a milder form known as hypomanic form. And the symptoms varies between hypomanic form and major depressive episode. So in bipolar 1, manic episodes or both manic and major depressive episode occur, whereas in bipolar 2, the less severe form or hypomanic form associated with major depressive episodes occur. So bipolar 1, there is occurrence of at least one manic episode or mixed both manic and depressive episode. Whereas bipolar 2 is characterized by periods of hypomania that typically occur either before or after the periods of depression, but they may also occur independently. It is the milder form and the patients are not need to require hospitalization. The type known as cyclothymic type, which is the mildest form of bipolar disorder, and the mood swings lies between the two poles of depression and hypomania. And again, in hypomania, the patient is not socially or professionally incapacitated, so the hospitalization does not require. Here is the pictorial demonstration of the symptoms. As in cyclothymia, the symptoms lies between hypomania and mild depression. Whereas in bipolar type 2, the symptoms lies between hypomania and major depression. Whereas in most severe form, that is bipolar 1, the symptoms lies between mania and major depression. So bipolar 1 is the severe form, whereas bipolar type 2 is the milder form, and cyclothymia is the mildest form of bipolar disorder. The differentials include general medical conditions such as hypothyroidism, as we have already discussed that hypothyroidism results in depressive phase, whereas thyrotoxicosis results in manic disease or manic phase. And specific extrinsic factors such as drug abuse, sedatives, tranquilizers, antihypertensive, and glucocorticoids may also result in depression. Sometimes schizophrenia may also mimic bipolar disorders. In Atlas bereavement, which is the term used to describe the death or loss of a family member. And in bereavement, the presence of sadness is considered a normal reaction. So keep calm and make a differential diagnosis. Treatment. The treatment lies between pharmacotherapy, psychotherapy, education of a patient, and extreme cases electroconvulsive therapy or ECT. Pharmacotherapy includes mood stabilizers such as carbamazepine, lamotrigine, and antipsychotics both typical and atypical such as haloperidol, clonazepine, olanzapine, risperidone, and benzodiazepine, and in depressive form antidepressants such as selective serotonin reuptake inhibitors or SSRIs, monoamine oxidase inhibitors, or tricyclic antidepressants. However, lithium is also used. Lithium is used and is more effective in manic episode of bipolar disorders. Education to recognize and manage the early symptoms also required. And psychotherapies include cognitive behavioral therapy or CBT, in which the patient is made to change his perceptions regarding his thoughts, his emotions, or his behavior. And family focused therapy, interpersonal social rhythm therapy, and psychoeducation regarding the symptoms and management. And in extreme cases, electroconvulsive therapy is performed. ECT is performed under general anesthesia, in which small electric currents are passed through the brain, and hence intensely triggering a brief seizure. These seizures result in change in brain chemistry in such a way that the symptoms reverse quickly or instantly. So at last, to summarize the disorder, the bipolar disorder is characterized by repetitive episodes of mania and depression. Mania is a superexcited form, whereas in depression, a person suffers from lack of activeness or decrease in energy level, and mania is better treated with lithium, whereas depression is better treated with antidepressants such as SSRIs, monoamine oxidase inhibitors. And in types, bipolar 1 is the most severe form, in which the symptoms lies between mania and severe depressive form, whereas in type 2, the milder form, the symptoms lies between hypomania and severe depression, whereas the least severe form or the mildest form, that is cyclothymia, the symptoms lies between hypomania and mild depression. And these does not require hospitalization. With proper pharmacotherapy, cyclotherapy, the outcome is good, and in extreme cases, electroconvulsive therapies is also done. So this is the end of lecture.